Hey everybody, Hirsch Shukla here with Orthopedic and Spine Physical Therapy, here to talk to you about another one of the most common causes of lower back pain and sciatica, and that is the herniated and bulging disc. Okay, what I've drawn here for you is a diagram of the spine. Okay, you have the vertebrae, you have the discs, you have the spinal cord, and you have the nerves that come out of the spinal cord at every disc level. Okay. This is what a healthy disc looks like. It's a hard outer shell. The red represents the hard outer shell, and then this blue area here represents the inner jelly-like material that lives in the center of the disc. Okay, in a herniated disc, what happens is this hard outer shell develops a little crack in it. Okay, when that crack happens, that jelly starts to ooze into that crack. Okay, that is the definition of a herniated disc. It's when the jelly oozes into the outer hard shell of that disc. Okay, now as time goes on, that herniation gets longer, it gets worse, and it goes farther out. Now as it goes out toward the outer wall of that disc, what ends up happening is the herniation ends up pushing the outer wall of the disc out toward the spinal cord. That is known as a bulging disc. Okay, right here is a bulge in the outer wall of that disc. When that bulge hits the spine or the spinal cord, or it hits one of these nerves that comes out of the spinal cord, that's when you start to have tingling, pain, and numbness going down into your legs to some degree. Okay, depending on the severity of the pressure on that nerve and how much irritation it's causing. Okay, that's what a herniated disc and a bulging disc look like. Now I'm going to show you a few exercises that you can try to control that pain and to potentially kickstart the healing process for that disc. So, first thing I want to say is that these are great exercises to try, but they are not for everybody. Okay, so you always want to listen to your body. If any of these exercises make your back pain or leg pain feel worse, stop the exercise and consult your provider of back pain services. Okay, all right, so first exercise is just going to be very simple. You're going to find a nice firm surface to lie on, and you're just going to put your hands one on top of the other and just rest your chin on your hands, and you're just going to lay flat like this. Okay, I want you to lay here for 2 minutes. Okay, during that 2 minutes, you might feel a little bit of pressure occur right in the center of your back. You might feel that pressure. You might feel some changes going on in the pain. Okay, those changes can either be worsening or they can, of course, be getting better. We obviously want them to be better, but what I want you to do is give it the full 2 minutes. Okay, if it gets way too bad for you to lay here, you have to stand up. Like, don't push that. Listen to your body. Listen to the pain. Your body will tell you if you're doing something wrong. So 2 minutes here. Okay. If the pain gets better, great. Your next exercise is going to be bring your hands back here. Okay. Put all of the support through your forearms of your arm. Okay. And what you're going to do is you're just going to push your chest slightly up off the table and come back down. You're going up and come back down. Listen to your back, listen to the pain. Your body will tell you if it's not good for you. All right, you just go up and you come back down. There's no hold at the top of the movement. You just go up and come back down. Very repetitive. All right, what you want to do is you want to do 10 of those and then go back to this position for maybe 20-30 seconds and then do 10 more. Okay, do 10 more. Same thing, listen to your body. Okay, if you do 10 more and you feel like, yeah, I can do that as far as I can't really push any higher. Okay, your next level, the next step, the third exercise in this series is going to be bring your hands back here, okay, under your shoulder, directly under your shoulders. You don't want them up by your forehead, you don't want them down here by your belly. Okay, you want them right here by your shoulders, and you're just going to try to push up, all the way up here, and all the way down. Okay, just pushing that spine just a little bit farther in a backward bending direction. Okay, backward bending is what is the key to all of these exercises. Getting your spine to go a little bit farther in this backward bending direction. Okay, this is going to push that jelly back to the center of that disc, and it's going to kickstart the healing process that needs to occur for that crack to seal off. and get you back to normal naturally without the use of medications, unnecessary medications, injections, and surgeries. Okay, again, the key to the real key to this is listening to your body. Listen to the pain. Your body will tell you if this is not something that you should be doing. Okay, I hope this helps you. Give me a like, give me a share, and stay tuned for more.